Sharing health data with other government and community providers helps the Department of Veterans Affairs provide world-class healthcare to veterans and service members. When we say sharing health data, we mean securely exchanging healthcare information between organizations and providers, so everyone involved in a patient's care has a complete view of the patient's health history. When clinicians can access a patient's complete health record from VA, DoD, and community providers, the veteran or service member will receive higher quality care, resulting in better health outcomes. In order to share health data, health information systems must be interoperable. Health information systems are interoperable when two or more systems can exchange and use information. Today, VA and DoD are working together to improve the interoperability of our healthcare systems, and we already share a lot of information. In fact, the two departments share more health information than any two healthcare entities in the world. Each day, VA and DoD systems answer 60,000 requests to retrieve information from 5.9 million shared health records and exchange 1.5 million pieces of health data. That's more than 500 million pieces of health data shared every year. VA-DoD interoperability is not a new effort. The two departments have shared health data for over 15 years. In 1998, VA and DoD began sharing health information between their two separate electronic health records. The idea was to help VA and DoD see a more complete view of their shared patients' health records and improve health care in both organizations. And sharing would also ease the burden of service members as they transition to veteran status. They wouldn't have to worry about their records getting from DoD to VA. There were a number of challenges to overcome as we began sharing health information. DoD's electronic health record, ALTA, and VA's record, VISTA, are separate systems. There are differences in the technology they were built on and the terminology they use to describe medications and conditions. But that doesn't mean that the data from the two systems can't be shared. Think of it this way. You can use an ATM card from your bank to conduct transactions using ATMs owned and operated by different banks, and even ATMs in different countries that have to convert currency. When you withdraw cash from another bank's ATM, it still updates your bank account information. Regardless of differences in hardware and software, the banks share an understanding of standardized data like PIN codes, account numbers, and dispensing of funds, such that they are interoperable. Health data is more complex, but the principle behind VA and DoD interoperability is similar. The departments had to start working together to standardize data and create ways for providers to securely access and view the data being shared. Through the DoD-VA Interagency Program Office, health data standards were identified, and the two departments began mapping the standards to their current data. Mapping provides common terms and codes to match patient health data between health providers, improving interoperability. While the departments have shared over 350 million pieces of health record data since 1998, DoD and VA continue to improve interoperability by standardizing how they record and share health data. That brings us to today, where VA and DoD have made significant progress to standardize the data they capture in their systems and to create ways for clinicians on both sides to view and use it as they care for veterans and service members. Today, clinicians can use a tool called the Joint Legacy Viewer, or JLV, to get a real-time view of patient records, including data from all VA and DoD sources. This means providers have immediate, up-to-date access to patient health information in both systems. For example, after a service member receives care at a DoD facility, the information is recorded in DoD's electronic health record. That information is available to providers at VA facilities the same day. The Joint Legacy Viewer is currently in use by more than 3,000 individuals throughout the VA healthcare system and is available at all VA healthcare facilities. VA is also dedicated to partnering with public and private health organizations that also provide care for veterans. These partnerships let VA send and receive patient health data to clinicians outside the VA healthcare system, where a veteran may be referred for specialized care. A recent partnership with Walgreens established a groundbreaking program that allows veterans to receive select immunizations at Walgreens pharmacies and have the immunization information automatically transferred into the veteran's VA electronic health record. The departments are continuing to improve sharing efforts to achieve seamless exchange between VA, DoD, and community healthcare systems. While the Joint Legacy Viewer currently provides a side-by-side view of VA and DoD health data, we're working to make it even easier for VA clinicians to access shared data. We're currently piloting a new tool called Enterprise Health Management Platform, or EHEMP, that will eventually replace the Joint Legacy Viewer and provide clinicians with more health data sharing functionality. Once fully developed and deployed across the VA electronic health record system, EHEMP will give clinicians a single, streamlined, reliable, customizable, and secure user interface that offers a veteran's complete patient history, including data from VA, DoD, and other external health partners. All the while, VA continues its commitment to achieving full interoperability with third-party providers, so that when veterans receive care outside the VA healthcare system, their VA health record can be kept up to date. This ensures that veterans continue to receive a high-quality, seamless healthcare experience. VA is already leading the way in health data interoperability, and we will continue to drive towards sharing more data with DoD and third-party providers as efficiently and securely as possible. It's our mission to provide world-class care to our veterans, and enhancing interoperability will help us achieve just that.